spectrum disorder. Autism is known as a complex developmental disability. Autism spectrum disorder (ASD) is a broad term used to describe a group of neurodevelopmental disorders. ASD can sometimes be referred to as autistic spectrum disorder. Autism signs and symptoms. People with ASD often have problems with social, emotional, and communication skills. They might repeat certain behaviors and might not want change in their daily activities. Many people with ASD also have different ways of learning, paying attention, or reacting to things. Signs of ASD begin during early childhood and typically last throughout a person's life. Social skills. The way in which a person with an ASD interacts with another individual is quite different compared to how the rest of the population behaves. Empathy, understanding and being aware of the feelings of others. A person with autism will find it much harder to understand the feelings of other people. Her ability to instinctively empathize with others is much weaker than other people's. Physical contact. Several individuals with an ASD do not like cuddling or being touched like another individual do. Loud noises, some smells, and lights. A person with autism usually finds sudden loud noises unpleasant and quite shocking. The same can happen with some smells and sudden changes in the intensity of lighting and ambient temperature. Speech. The higher the severity of the autism, the more affected are a person's speaking skills. Many individuals with an ASD do not speak at all. Repetitive behaviors. A person with autism likes predictability. Routine is her best friend. Going through the motions again and again is very much part of her life. An individual with autism develops differently, while an individual without autism will develop in many areas at a relatively harmonious rate. This may not be the case for an individual with autism. Learning may be unpredictable. How quickly an individual with autism learns things can be unpredictable. They may learn something much faster than other individual, such as how to read long words, only to forget them completely later. Physical tics and stimming. It is not uncommon for people with autism to have tics. These are usually physical movements that can be jerky. Some tics can be quite complicated and can go on for a very long time. Myths about autism. A person with autism feels love, happiness, sadness, and pain just like everyone else. Just because some of them may not express their feelings in the same way others do, does not mean at all that they do not have feelings. They do. It is crucial that the myth, autistic people have no feelings, is destroyed. Diagnosis. Diagnosing ASD can be difficult since there is no medical test, like a blood test, to diagnose the disorders. Doctors look at the child's behavior and development to make a diagnosis. ASD can sometimes be detected at 18 months or younger. By age 2, a diagnosis by an experienced professional can be considered very reliable. Causes. Autism. The exact cause of ASD is unknown. The most current research demonstrates that there is no single cause. Some of the suspected risk factors for autism include having an immediate family member with autism, genetic mutations, Fragile X syndrome and other genetic disorders, being born to older parents, low birth weight, metabolic imbalances, exposure to heavy metals and environmental toxins, a history of viral infections, fetal exposure to the medications valproic acid, Depakine, or thalidomide, Thalomid. Other screenings and tests. Your child's physician may recommend a combination of tests for autism, including DNA testing for genetic diseases, behavioral evaluation, visual and audio tests to rule out any issues with vision and hearing that aren't related to autism, occupational therapy screening, developmental questionnaires, such as the Autism Diagnostic Observation Schedule, ADOS treatment. There is currently no cure for ASD. Early intervention services help children from birth to 3 years old, 36 months, learn important skills. Services can include therapy to help the child talk, walk, and interact with others. Many treatment approaches involve therapies such as behavioral therapy, play therapy, occupational therapy, physical therapy, speech therapy, massages, weighted blankets and clothing, and meditation techniques may also induce relaxing effects. However, treatment results will vary. Some people on the spectrum may respond well to certain approaches, while others may not. Alternative treatments or alternative treatments for managing autism may include high-dose vitamins, chelation therapy, which involves flushing metals from the body, hyperbaric oxygen therapy. Remember that autism is complex, and that it takes time for a person with ASD to find the program best suited for them.